Hello, I'm Dr. Bill Morgan, and I'm going to be doing the podcast today on driving out stress. A little bit of my background: I'm an MD, graduated from Indiana University School of Medicine. I completed a pediatric residency and an allergy and clinical immunology fellowship, and I'm board certified in both. I retired in 2014, but quite frankly, I flunked retirement and I went back to school, and I have a master's in counseling psychology. Following that, I completed a 2-year course at the Harris Infant and Early Childhood Program at the Southwest Human Development Institute. And my interest is really early childhood development and how that applies to us as adults. So to begin driving out stress, we're going to look at the concept of water on the floor. And you've got a glass full of water. And when you have stress, if you can imagine the actual glass of water shakes and there is some water spilled on the floor. The shaking is your body's reaction to stress. And so what we're going to discuss is how can you help control your body's reaction and your mind's reaction to stress. So the first objective is, what is stress and how does it impact one's ability to effectively communicate and maintain meaningful relationships? The second objective will be, what is the pathway and realities for navigating through crisis, challenge, and risk? The third objective is, when stress becomes distress, where is it most likely to manifest in the workplace? Fourth objective will be, what is compassion fatigue? What are the essentials for overcoming it? And how can we begin to move forward? The fifth objective, what are the realities of change and transition, and how is the workplace impacted by those realities? And number six objective is, what can we do today to begin to drive out stress and overcome compassion fatigue? So what keeps a person stalled and ineffective? And part of it is, what do I believe? What do I think I know? And the more frustrated or problematic it is for us, we tighten our grip, our body tenses up, and the less we will learn and grow. And so how can I break through my wall? So let me give you an analogy. I love golf. And for the longest time, I tried, when I was going to swing the club, to grip the club as hard as I could until the tension went from my hands up to my shoulders, and then when it got to my neck, I could swing. Well, it took me a while to realize that I was impeding my own self by doing that. So the treatment is, relax your grip, relax your body, and be in touch with that. And we'll go over how to do that. So chronically perceiving threat without relaxing your body is like flooring the accelerator of a car while keeping your other foot on the brake. You burn out your engine and you get nowhere. So I want you to think or reflect on your workplace experience. I want you to write 2 to 3 words or phrases that depict what is stressing you, where you might feel overwhelmed or burned out by what is expected of you. As you do, there is a particular word or phrase that seems to keep repeating itself in your daily life. So circle it or highlight it, and you can reflect on that. So let me give you a minute to think about that. And then write the first things that come to your mind. So in section 1, we're going to discuss what is stress, how does it impact one's ability to effectively communicate and maintain meaningful relationships. But before we do that, I really want to go into some very basic background information that I think will be very helpful. And the first thing I want to talk about is attachment. And we have 3 types of attachment. And secure is when I find it relatively easy to get close to others and I am comfortable depending on them and having them depend on me. I don't worry about being abandoned or about someone getting too friendly to me. On the other hand, insecure ambivalent, I find that others are reluctant to get as close as I would like. I want to get involved completely with another person, and this thought sometimes scares people away. And then there's insecure avoidant. I am somewhat uncomfortable being close to others. I find it difficult to trust them and difficult to allow myself to depend on them. I am nervous when anyone gets too close. So a word about attachment. Attachment is a phenomenon, particularly of human beings, where an infant has the drive to become attached or close to the mother figure. And believe it or not, by about 13 months to 2 years of age, your attachment pattern is pretty well set. So, having said that, we know this plays out in what's called the circle of security. And that is, if you on the left see the secure base or safe haven, that would be the mother. And over time, that toddler, let's say, will learn to explore and can only get so far in that circle until they get a little anxious because they're too far away and they come back. Now, if you're an anxious attachment, you will not get nearly as far because of your anxiety, and you'll want to get back to your secure base. But if you are an avoidant, you will go farther than the secure one because you know that mom's really not going to be there for you. And so you may go farther before you come back. So how this pattern of attachment works is that in your life, every relationship you have, this attachment pattern will play out. And we all know people who are very anxious, and this affects their relationships. And we know people who are avoidant, and you can't get close to them. So this is a pattern established very early. Now, I also want to talk to you briefly about a concept of how our body reacts. And this is a polyvagal theory based on the research of Stephen Porges and others. So the simple way to think about it is you have a traffic light. In the green section, the green light, we are in our social nervous system, and we're able to relate with others. If we get into a situation where we are feeling threatened, our sympathetic nervous system kicks in, and that's our fight or flight system. But if it really gets bad enough, we will go into a red light or a freeze or submit system. So this is the way our body reacts. And what we really want to do is stay with the green light. With our social nervous system, our ability to be able to relate to others, to think clearly, and not get ourselves in trouble with either the sympathetic nervous system being overused or the submissive system, the freeze system being used. Now, I'm going to show you a video in just a moment about adverse childhood experiences. And these experiences usually occur within 18 years of age. And you can see the tree listed here with a variety of things that may happen in your home, including domestic violence, substance abuse, emotional and sexual abuse, maternal depression, physical, emotional neglect, divorce, mental illness, incarceration, and homelessness. But we know there's more to this picture than just the tree. And below ground, if you want to think about it, we have our environment, our adverse community environments. And that includes other factors that affect us, like poverty, discrimination, community disruption, where you're moving from one location to another, a lack of opportunity, economic mobility, and social capital, poor housing quality and affordability, and certainly violence. So it's not just what happens in the home, but also what kind of environment, what kind of community are you living in? Next, we're going to show you a video by Dr. Nadine Burke-Harris, who's a pediatrician, and she has done extensive work and published on adverse childhood experiences.
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or a packaging chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence. Now, for a long time, I viewed these things in the way I was trained to view them, either as a social problem, refer to social services, or as a mental health problem, refer to mental health services. And then something happened to make me rethink my entire approach. When I finished my residency, I wanted to go someplace where I felt really needed, someplace where I could make a difference. So I came to work for California Pacific Medical Center, one of the best private hospitals in Northern California, and together we opened a clinic in Bayview Hunters Point, one of the poorest, most underserved neighborhoods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle, and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities: access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, Dr. Burke, have you seen this? In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand, better than we ever have before, how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed. So for me, this information threw my old training out the window, because when we understand the mechanism of a disease, when we know not only which pathways are disrupted, but how, then as doctors, it is our job to use this science for prevention and treatment. That's what we do. So in San Francisco, we created the Center for Youth Wellness to prevent, screen, and heal the impacts of ACEs and toxic stress. We started simply with routine screening of every one of our kids at their regular physical, because I know that if my patient has an ACE score of 4, she's 2.5 times as likely to develop hepatitis or COPD. She's 4.5 times as likely to become depressed, and she's 12 times as likely to attempt to take her own life as my patient with 0 ACEs. I know that when she's in my exam room. For our patients who do screen positive, we have a multidisciplinary treatment team that works to reduce the dose of adversity and treat symptoms using best practices, including home visits, care coordination, mental health care, nutrition, holistic interventions, and yes, medication when necessary. But we also educate parents about the impact of ACEs and toxic stress the same way you would for covering electrical outlets or lead poisoning. And we tailor the care of our asthmatics and our diabetics in a way that recognizes that they may need more aggressive treatment given the changes to their hormonal and immune systems. So the other thing that happens when you understand this science is that you want to shout it from the rooftops, because this isn't just an issue for kids in Bayview. I figured the minute that everybody else heard about this, it would be routine screening, multidisciplinary treatment teams, and it would be a race to the most effective clinical treatment protocols. Yeah, that did not happen. And that was a huge learning for me. What I had thought of as simply best clinical practice, I now understand to be a movement. In the words of Dr. Robert Block, the former president of the American Academy of Pediatrics, adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. And for a lot of people, that's a terrifying prospect. The scope and scale of the problem seems so large that it feels overwhelming to think about how we might approach it. But for me, that's actually where the hope lies. Because when we have the right framework, when we recognize this to be a public health crisis, then we can begin to use the right toolkit to come up with solutions. From tobacco to lead poisoning to HIV/AIDS, the United States actually has quite a strong track record with addressing public health problems. But replicating those successes with ACEs and toxic stress is going to take determination and commitment. And when I look at what our nation's response has been so far, I wonder, Why haven't we taken this more seriously? You know, at first, I thought that we marginalized the issue because it doesn't apply to us, right? That's an issue for those kids in those neighborhoods, which is weird because the data doesn't bear that out. The original ACEs study was done in a population that was 70% Caucasian, 70% college educated. But then, the more I talk to folks, I'm beginning to think that maybe I had it completely backwards. If I were to ask how many people in this room grew up with a family member who suffered from mental illness, I bet a few hands would go up. And then if I were to ask how many folks had a parent who maybe drank too much, or who really believed that if you spare the rod, you spoil the child, I bet a few more hands would go up. Even in this room, this is an issue that touches many of us. And I'm beginning to believe that we marginalize the issue because it does apply to us. Maybe it's easier to see in other zip codes because we don't want to look at it. We'd rather be sick. Fortunately, scientific advances and, frankly, economic realities make that option less viable every day. The science is clear. Early adversity dramatically affects health across the lifetime. Today, we are beginning to understand how to interrupt the progression from early adversity to disease and early death. And 30 years from now, the child who has a high ACE score and whose behavioral symptoms go unrecognized, whose asthma management is not connected, and who goes on to develop high blood pressure and early heart disease or cancer will be just as anomalous as a 6-month mortality from HIV/AIDS. People will look at that situation and say, what the heck happened there? This is treatable. This is beatable. The single most important thing that we need today is the courage to look this problem in the face and say, this is real, and this is all of us. I believe that we are the movement. Thank you.
So let's talk about stress. Stress occurs when there's a demand or an expectation. And so we know the supportive features for us are peer support, access to resources, and self-care, the 3 balls on the left. And on the right side are demands and expectations. And the ball underneath this teeter-totter, if you're familiar with that from your childhood, represents our threats. How big is that threat? How big is that ball? What does it mean to us? So as long as the individuals see themselves capable and competent to meet the demand or expectations, then stress is generally not overwhelming. In fact, meeting the demands or living up to expectations can be rewarding and is a way of developing resilience. So now we'd like to discuss a Yerkes-Dodson model of stress. And what we see on the horizontal axis is a measure of body arousal, tension, and anxiety. And on the vertical axis, we see level of performance. And what we know is that as we start at the very beginning of this curve, we're sleepy, we're waking up, it's a low threat, whatever we're encountering, we're relaxed. And then it gradually gets our attention and we become informed awareness, we have increasing interest, and we're ready to engage. And next you see in the purple section that now we reach a level of optimum performance. This is the me I want to be. This is when you're, if you will, you're in your zone. So this is good stress. However, if this stress keeps going, you're going to pass the point of optimal performance, and now you become overwhelmed and reactive. You're easily frustrated and angered. You're easily distracted. You're sleep deprived, and it leads to lacking awareness in your daily environment. You're hypervigilant. It's easily to go into panic attacks, anxiety, feeling high threat. And finally, if it's bad enough, you'll just disengage. And if you want to think again about the polyvagal theory and freeze or submit, this is the disengaged part of it. You have checked out. And the early part of this distress, where you're overwhelmed, reactive, easily frustrated, angered, is your sympathetic nervous system kicking in. So now we're going to do 3 case studies. Hannah, she's a single mom in her mid-30s. She's been with the agency 3 years. She began as an administrator, finished her degree online. She was just promoted to a caseworker. Her initial caseload is heavy, but she was told she would be paired with someone experienced until she got comfortable. However, that intended person left the agency and no one else was available to train her, to be her mentor, etc. And so she spent a month floundering. I was afraid to say anything, to ask for help. And so when you look at Hannah's stress level, where is she? Well, I would imagine at this point she is past optimum performance and she's on overwhelmed and reactive. And if it keeps going bad enough, she'll eventually disengage, such as maybe just quitting. So in Hannah's case, you can see that she is on the right side of this curve. So what might be overwhelming Hannah? I think she's just overloaded. This is really stressful for her. Why is she afraid to ask for help? I think she's probably embarrassed. It's a sign of weakness for her. Maybe she's thinking to ask for help. At what point did her stress move into distress? I would imagine it would be when her caseload was quite large. I would imagine it would be when her supervisor or mentor or trainer was not available. How would Hannah benefit from self-care, peer support, and access to resources? Probably very well, in the sense that how can she calm down her own autonomic nervous system? How can she engage peer support, such as with team members who can help walk her through these cases? And plus give her access to resources, perhaps with a trainer in the office or other ways of becoming more clear on what she has to do. So if we talk about a team, when we all seem to work in teams one way or another, co-workers from different departments are teamed to address concerns for an upcoming audit for compliance with an outside accreditation agency. However, 3 times their deadline has been moved up. Meanwhile, the organization is relocating their offices. And then finally, a new hire joins a team that needs to be oriented and trained. And now your supervisor introduces the new hire. They are here to give you all some new perspective and to wrap things up. Well, that to me sounds like a whole layer of complexity thrown into this. And so the team hopefully was doing pretty well in the optimum performance range, and now all these new challenges were added. And so it's easy to understand how they've now passed optimum performance and they're into the overwhelmed reactive mode on the other side of the curve. And if it gets bad enough, they will eventually disengage. And so they are on the downside of the curve on the right side here. So why might these team members be afraid to speak up? One, they're embarrassed. They may not feel like they have the words to discuss what is really bothering them. At what point did their stress move into distress? Any number of those factors, I'm sure, are important. But certainly, not only the accreditation coming up, but now you have to adjust your agenda and move before you're ready. How would the team benefit from self-care, peer support, and access to resources? Well, self-care, which we'll discuss, is really something only you can do on your own, but certainly the team could work on that. The team can work to support each other and to find out what access to resources might they find. Now, in an organizational challenge, the CEO's report was unsatisfactory to the board, and unhappy remarks were made as everyone left the meeting. Budgets will be trimmed and staff reduced as there is now a hiring freeze. Boy, that's going to create anxiety. A recent news article created some negative trends in social media regarding the general state of affairs for community service providers. And finally, the CEO said, after all these years, nobody seems to give a rip about the sacrifices we make around here. And I don't know if he's speaking for himself or he's including all the team members under him. So again, let's assume this group was working in optimum performance, but now given these challenges, they are overwhelmed and reactive, and that's everybody from the CEO on. And at some point, they become disengaged if it goes bad enough, and they quit or look for new jobs. So they're clearly on the right side of this curve. Why might people in this organization be afraid to speak? One is embarrassment. Two, I think, would be that you might lose your job. They're looking to have a hiring freeze and perhaps start reducing their workforce. Why do people wait until after the meeting before saying what is on their minds? I would think it's going to take time to process all this information. And besides, speaking up is a risky thing to do, and it's safer to talk to your fellow team members. How would the organization benefit from a workplace environment that supports self-care, peer support, and access to resources? They need all those, but it really starts with the CEO. And how can he or she manage these three issues, not only for themselves, but for everyone working under them, with self-care, peer support, and access to resources? So back to the full glass of water and the shaking and water on the floor. Living life and working with others is messy. Why is this true? Well, that's why it's called life. People are not always predictable, logical, unemotional, and well organized. It is a fantasy to think they will be. people are not objective about their job. They tend to take their work personally. And usually, it's certainly in healthcare, that's because we care. Human feelings cannot separate their personal lives and the quality of their work. So I know compartmentalization is a big buzzword that if you can just compartmentalize your work from your home life, et cetera, you'll function well. But the human mind doesn't work that way. When an individual cannot do what is perceived as the right thing or perform at the right level, it generally bothers them a great deal. Most of the people in healthcare are perfectionists, firstborns, if you will, or only children. And so doing the right thing is critically important to them. Fear of repercussions is a barrier to quality work and work relationships, and these emotions tend to be strong. So, given all these factors, it's normal to have shaking and spill some water on the floor for your body to react to these stresses. So what have we learned so far? Stress occurs when there's a demand or expectation put upon us. Distress occurs when we cannot meet those demands due to lack of self-care, lack of peer support, and limited access to resources. Shaking is normal. Your body's reaction to these stresses is normal. Resiliency is not achieved by reducing the shaking, but by increasing our capacity to live through adversity and learn from the experience. Let me give you an example. I think those of us that are physicians, everybody remembers your first day of your residency. And I remember our chief resident passed out different charts on all the patients that we were going to be taking care of. And lo and behold, I was reviewing those charts when I turned around to ask a question. He was not there. He'd left. And about 30 seconds later, a nurse comes up to me and says, "The child in room 304 now has a temperature of 102. What do you want to do?" And I had no idea about this kid, about the disease process, treatment, et cetera, et cetera. And so I was under a lot of stress at that point to do the right thing and get up to speed on my patients. So Bruce Perry is a PhD, MD, child psychiatrist, and a neuro researcher. And one of the things he said is the currency for systemic change is trust, and trust comes through forming healthy working relationships. People, not programs, change people. Now is section 2, and we're going to talk about the pathway and the realities for navigating through crisis, challenge, and risk. And we're going to have a video on adaptability by Jennifer Jones. And this is going to go over safety, trust, and relationships, if you will, people.
Change has always fascinated me. We go through so much of it in our lives, me included. My parents divorced. I was widowed in my 20s. I've been a single parent, and my whole career has been built around helping others deal with change. Why do we respond to it differently? How can some people just adapt while others clearly struggle? Let's face it, the pace of change is not slowing down. 80% of the jobs which will exist in 2025 do not exist today. The average amount of jobs in someone's lifetime is now 6, in 6 different companies. That's a lot of change. And given that 1/3 of the UK workforce is, at this moment, dealing with an anxiety, well-being, or mental health issue, the data suggests that we're not coping very well with what's going on. I believe that we're going to have to do better at change. I believe that we're losing the ability to adapt proactively because we're not taking the time and attention to prepare and develop ourselves. We're constantly jumping from change to change, acting on impulse, not acting on strategy. And so that's why I'm on this stage today. My purpose is to help you respond to change how you want to and be the person that you want to be while you do. It all started with a little project to see, what made some people adaptable and others not. I researched into theory and academic literature, launched a full-scale review at work of thousands of stories of lives and careers and breakthroughs and insecurities. Naively, I thought it might be easy to begin with, but it wasn't, and my little project became 10 years' worth of work. But now I can share with you a formula for success, which will help you both in work and out of it. But first of all, let me share with you a couple of insights. During this time, I was working in Australia, and I was travelling back and to every couple of months. And I was a single parent at the time, so it required a lot of organisation and planning, but also brought with it a lot of tiredness and guilt. And on this particular trip, my children were really struggling with me being away this time. And I was in a meeting with my colleagues, and I was checking my phone occasionally to make sure that they were okay and that they didn't need me. And my colleague called me on it, and he said, "Jen, you keep looking at your phone. Are you bored? I'm finding it really distracting. You have to stop." Now, I'd like to say that I responded to his request to change my behaviour, with gratitude and thanked him and put my phone neatly into my bag. But I didn't. I stood up and I raised my voice and I launched into a justification of my behaviour, telling him how only a couple of hours before I'd FaceTimed my sons and they were so upset, they were so emotional with me not being there that they couldn't even say my name. And if it's okay with him, I'd just like to check that they're okay. I'm not proud of it. It wasn't my finest moment, but it isn't always easy to respond to change how we want to. And my tiredness and guilt, it had worn down my adaptability, and I was less able to control my response. We all struggle to adapt sometimes, and quite often the coping mechanisms that we've had in the past don't necessarily work in the future. As we progress into leaders and parents and mature human beings most of the time, we need to be even more aware of how we respond to change so that we don't cause ourselves anxiety or regret because we're just acting incongruously with who we are. Also, we don't unconsciously also teach others how to struggle. It reminds me of a lady I worked with called Jane. And Jane had been recently promoted, and she was overcome by the amount of change that this new role brought with it. Her response to change was quite aggressive and perfectionistic. She liked to control everything. And with this new role, it just wasn't possible anymore. The role was too big for her to get her arms around in the same way. Since she'd taken the post, she'd had 2 team members go off with stress. She had another 2 who'd just become yes men. They're obviously out of fear. And her peers saw her as inconsistent, and they just didn't know which Jane was going to turn up. We were in the middle of a coaching session, and she put her head in her hands, and she said, "Jen, there's just too much change. We're going to have to stop. We'll work on me when all of this has died down," just at the time when she needed it most. Luckily, she did reverse her decision a couple of weeks later, but it brought home to me the importance of this project of mine. Because this is how we live our lives, isn't it? In the midst of so much change and urgency, that we respond, we react instinctively, and we react to what's in front of us because we have to. But we don't take the time to prepare ourselves in advance of the change. And I responded to just a colleague's perception of my behaviour. Jane responded to another change on her plate. Neither response was planned, they were automatic and instinctive. but they were inconsistent with who we are and where we want to be. We can't always control the change that happens to us, but we can manage our response to it. And this is what I found out about how to do that. I found that those people who were able to be adaptable, who could respond to change how they wanted, they had this certain adaptability, and it meant that they had certain characteristics in common. In those who struggled to adapt, these characteristics were minimal or missing, and I call it the adaptability equation. Purpose, inquisitiveness, resilience, and threat. Developing your capability in these areas will help you to be more adaptable. Let's take purpose. Winston Churchill once said that you will never reach your destination if you stop and throw stones at every dog that barks. He was talking about purpose. Those with a strong purpose know that it's actually their purpose that will help them to weather the storms without getting distracted or demotivated. And it helps them to be more adaptable because it's their purpose that guides them to make the right choices in the face of change. Take Elon Musk as an example. Some people think he's set up an electric car company, but his purpose is to rid the world of carbon emissions. Today he chooses electric cars, tomorrow it's solar power or the Hyperloop. The power of purpose is so strong. Why do you think Tesla is worth more than the Ford Motor Company, even though it's never made a profit? And do you know your purpose? And whether your everyday habits and choices take you closer to it or further away? Inquisitiveness is the inner child that asks 100 questions a day. It requires space and headroom and a certain mindset to constantly learn and grow. Dr. Carol Dweck would call it the growth mindset. And these people, they're able to constantly scan the environment, looking for the need to adapt in the future. And this makes them more adaptable because all the powerful thinking and insight has happened before the change hits them or before they decide to make a change. Think about it. The more questions you ask, the more you learn. The more you learn, the more questions you think of to ask. It's a reinforcing cycle. So think about a problem in a different way. Try a new solution. Ask the stupid question. And then I found a characteristic which involved overcoming setbacks and reducing stress, both for the individual and for those around them. And this I call resilience. It's been proven that the formation of a habit is not affected by falling off the wagon every now and then. So that cake you ate while you were on your diet or that outburst you had while you were working on your self-control, they're normal, they're to be expected. And it's actually overcoming these setbacks and learning from them which will help you to be more adaptable. So be honest with yourselves. Have the setbacks and changes that you've experienced, have they made you settle for being off course? Or are you still on track to being who you want to be? Now, these first three characteristics had a positive correlation with adaptability. So developing a high capability in these areas will help you to be more adaptable. But then I found a characteristic which had a negative correlation with adaptability. So a high level of threat will actually hurt your adaptability overall. The aim here is to reduce it. We all have a threat response when we're faced with a real or perceived danger, and this can be as subtle as aggressive body language or a different point of view or a threat of looking stupid. The effect on the brain is the same as being followed down a dark alley. In Australia, I was in a high state of threat. My children needed me, I wasn't there for them, and my colleague, while well-intentioned, was keeping me from the only partial responsibility that I could take, which was checking my phone. To be highly adaptable, you need to have a strong awareness of your threat response, what it looks like, what it feels like, what triggers it, and how best to manage it. So here's the equation. Adaptability equals purpose plus inquisitiveness plus resilience divided by threat. To be highly adaptable and be able to respond to change how you want to, develop your PIR, reduce your T. Now, what's interesting about all these characteristics is they're non-fixed characteristics. They're not genetic. They can be learned and developed over time. This was quite a breakthrough for me because I realized that all these people I'd studied and worked with who were adaptable had not just been adaptable. They had learned how to be adaptable. You see, historically, it was thought that the brain was a physiologically static organ. It's created in childhood, and now we're just stuck with what we've got. And while it's true that the brain is much more plastic in the early years, plasticity happens throughout life. We just may need a little bit more focus and persistence as we get older. We are meant to adapt. But the brain is also highly efficient, and this means that it will look for patterns to avoid us having to consciously think about the same things over and over again. So just like a river flowing down a well-worn riverbed, the brain will take the easy route, encouraging us to think in the same way, react in the same way, and creating automatic thinking habits and blind spots. It's much easier to continue doing something we've always done than it is to stop. Unless we know this and we make a conscious commitment to change. We all have the capacity to learn, and we all have the capacity to learn how to adapt. We just have to start. So today, I challenge you. Research shows it takes 66 days for a new habit on average to form. From today, that takes us to just past New Year's Day. Start today to being the person you want to be in the face of change. Don't wait for a resolution to be someone new next year. Look at the adaptability equation. Which areas do you need to focus on so that you can respond to change how you want to and be the person that you want to be while you do? Develop your PIR, reduce your T, and encourage others to do the same. Thank you.
How does crisis, challenge, and risk benefit organizations and grow people? The tools for correcting and resolving these issues are within each employee. These issues and reasons or seasons can serve as an impetus for open and honest relationships between coworkers, employees, and management with clients. Individuals need and want opportunity to benefit from their mistakes. So being able to work in an environment where you feel free to take risks, feel free to try, and know that the organization will support you if you fail and work to help you be successful. So the pathway for dealing with crisis, challenge, and risk, we're going to talk about the Dunning-Kruger Effect. And so on the horizontal axis is competence, the vertical axis is confidence. And so you might think at the very beginning, I have this all figured out, no problem. But you soon realize I had no idea it was going to be this bad. There are so many problems and threats. So let's say maybe I was comfortable seeing 20 patients a day in my outpatient office, but now I've been scheduled for 30, and these are all complex problems. And I quickly realized I had no idea it was going to be this bad. There are so many problems and threats. I'm not capable. We're not going to make it. I don't know how I'm going to get through this. Every case is a disaster. But you get your team together, you get organized, and you begin to work harder and smarter. And now I am beginning to see the possibilities that we can do this. I am learning and getting better. We are resilient. So being able to bounce back from this challenge, this setback, and become successful is how we become resilient. So what have we learned so far? Stress occurs when there's a demand or expectation put upon us. Distress occurs when we cannot meet those demands due to lack of self-care, lack of peer support, and limited access to resources. Crisis, challenge, and risk are how we grow. Ready yourself and your team for the dip. Ready yourself and your team for the dip. One of the most common causes of a dip that I hear of is when you've had to switch to electronic medical records, or you now have a new system that your company has bought, and now you have to learn that. At the same time, seeing 30 patients a day. So this is, I think, one of the bigger challenges that we all face in medicine.